Hi, Nursing 6181, Dr. Tim Paxton here. We're into week number 3, and this week we're going to be continuing on with health promotion and prevention concepts. This week it's related to social determinants and health risk. Your objectives this week are to really take a wide-eyed view at the different elements that actually affect health from a broader perspective, and these are the social elements. So we hit family, we hit community last week, we had a little bit of individual week 1. This week we're actually going to be looking at the elements from the social aspect. So for this week, what I'm hoping that you gain from this is you gain that understanding of how social determinants influence and affect health. These social determinants can be those of your peer group and how they affect you and the habits of those peer groups. So let's say it's recreational use of marijuana or it's climbing the 14ers. That you're able to define the different levels of prevention this week, and there are 3 different levels of prevention. Those were introduced to you in week number 1, and that you're able to translate how lifestyle choices related to nutrition and exercise increase the risk of disease in an individual. Now, when I say translate, this is taking the information that you're learning from your textbooks and from the online modules and being able to put that into a literary language that a patient can understand. So this week you have 2 chapters to read in Rotman and LaFontaine. The first one is Epidemiology to Chronic Disease and Risk, and the second chapter is about pathophysiology. Now, several of you may feel that you may not need to read this chapter, but I highly encourage you to read it because it provides you with a foundation of learning how to translate very complex information related to cardiovascular into very simple knowledge that you're able to then use with your patients. So I'm trying to lay a foundation of translational knowledge with you by reading that chapter. You also may find that you'll learn something new that you may not have learned in your pathophysiology class. Chapter 9 in Edelman is your third chapter for reading this week. I highly recommend that you take a look at the screening recommendations for primary care practice. These are what we are held to for standards in primary care. The CDC also has social determinants listed in a website that you may find very helpful. You have 2 videos to view this week. Both of them are on obesity, which is a rising epidemic, along with the opioid crisis that's occurring currently. I'm hoping that after you view these, that you are able to gain a different perspective in relationship to obesity, the underlying elements, and the genetic component. This weekend, I happened to be watching a documentary about the one-ton family. This is a grossly obese family who are genetically predisposed to obesity. 5 family members, all of them weighing over 350 pounds, with the most coming in at 825. It was quite the most interesting documentary. Then we're going to talk a little bit more about risk and really start looking into different elements that interplay into risk. And one of the greatest risks that we have as humans is inflammation. Inflammation causes problems within our arterial system, our venous system. It's the foundation of the development of coronary vascular disease and the laying down of plaque. It causes different hormones to be released in our bodies, such as cortisol and our free radicals, that then lead to other inflammatory problems, which can then mediate into obesity. So, gaining an understanding of the relationship of inflammation to disease is really important for you to get at this point. Getting this understanding related to inflammation and how inflammation literally is the cornerstone of a lot of chronic disease can help you understand then how nutrition and exercise actually are 2 interventions that we can use as nurse practitioners to actually work to prevent, promote, and reverse diseases that are occurring. You have a coaching moment. It's in the format of a quiz, but it's not really a quiz, but it was the best format to put it in to get the information that I needed from you. You're going to be watching a video, and there are two essay questions that I'd like you to answer after you watch the video. The video is called Wall-E, and if you look at this video with an open mindset and to what is occurring in our society today and technology, look at the younger generation that is coming up, our 5 to 10 year olds, and can you see what this cartoon video is depicting potentially actually being reality? So this is a fun little cartoon, but in its funness, there is a very, very strong message being conveyed. And if you really look at it for what it is, it's point on. You have a CLT discussion this week, and that discussion has 3 different questions I'm asking you to please answer. Your first posting is due by Wednesday, and then responding to 2 others. I have a video for you to watch here. It's about epigenetic transformation by Dr. Peak. This is a really phenomenal video. It also relates back into genetics and nutrition, and I'm hoping that you'll find it as informational as I did when I first viewed it. It has quite a bit of information in it. Tell me what you think. You don't have a lot of work this week in relationship to other elements besides that discussion, but I am going to start getting you prepped for your major paper that is due week number 4, and this is due on Sunday of week 4 at 23:59 p.m. as you will see it listed in the module. This is your health promotion and risk assessment paper. This is taking all the elements that you have learned in weeks 1, 2, 3, and 4 and actually applying it in a way that is an organized thinking structure or clinical reasoning structure like a nurse practitioner would. This particular paper will be written in correct APA format. You are going to use headings. There are actually 2 pages to the instructions, which you will see in the instruction area. I have highlighted and bolded the headings that you will use. Your first element of this paper is the genomic influences, and I'm asking you to research the concepts associated with what you're finding in the patient scenario. Please make sure that you look at genetic association and heredity for the development of depression. This is going to need to be cited. The next element you're going to look at is the social determinants. You have begun looking at those in this week. So look at the environmental influences, the cultural influences, what safety factors and risks can impact this particular patient, and how do they mediate his self-care. Identify from the scenario pertinent patient health history that can be elements that can impact his health. Make sure to include cultural aspects. Now, he is a Caucasian male, but look at the elements that are surrounding his gender and what could potentially be affecting him. So you may need to go back to stages of development and pull that forward. The next element is lifespan considerations, taking into account his age and his gender, and looking at these factors from the scenario perspective, and how are these going to be factored into developing a plan for him. I want you to identify and discuss specific functional problems assessed from this scenario related to his lifespan. Include 2 ways of managing these functional problems that support positive health promotional initiatives. I also want you to make sure that you're discussing how depression can adversely affect a health promotion plan, and then identify at least one intervention to assist in motivating the individual who has depression to try and engage in the plan that you put together. You will need to go searching the literature for this, and you will need to cite this. Your next element that you're going to discuss is the complex health system. This health system relates to the family, his social group, the community surrounding him, members of his family, the members that are involved in his employment, and how can these all impact him and the initiatives for promoting his health and his safety. Now, I am saying that you can choose just one to discuss of these elements. So you may choose to just focus on his work environment, or you may choose to work on his elements of the family and that it's a fractured family. You may choose to look at his newly divorced status. You may choose one of those, but please make sure you address it in a full manner that gives me an understanding that you do understand how this element can come into play and affect him from engaging in a health promotional plan for himself. The third or the final element is exercise and nutrition. You're going to review that case and you're going to assess the patient and identify how you would use exercise and nutrition modifications to help improve his health. Now, this may be even an entire page separated into numerous paragraphs. It could be 2 pages, but I want this to be a really well thought out and translated element of this assignment. From the case scenario, please identify his barriers and how you plan to try and work with them. And then I want you to write a paragraph that illustrates how you would discuss these topics with the patient. And I do not want this written from how you would talk about it with me. I want you to write it from the literary perspective of the patient. So don't use high-end medical terminology. I need you to break it down into simple terms that this patient can understand. And that would be a paragraph explaining how you're going to start him into a plan to help him. And then I want you to write a conclusionary paragraph. And in this conclusionary paragraph, I want you to indicate your intention for health plan development. Now, this paper puts together all the elements that you need to take into consideration when you're doing a health promotion plan for a patient who is as complex as Alex is. I'm not asking you to completely write out that plan. What I'm asking is for you to summarize what you have written previously to the conclusionary paragraph. So, for instance, you could start, in conclusion, this health promotion plan is going to include elements that will address the social issues of isolation that this patient is experiencing, period. Numerous discussions will need to take place with this patient in the following weeks in relationship to rehabilitation related to his MI, period. So see where I'm going on that? So you're just going to kind of outline it out in a paragraph format. Then your final element is a reference page. This will need to be written in the correct APA format. Please make sure that you are using proper citations throughout the paper. Remember that if you were quoting something directly, that the page number needs to come after the end of the quote. Depending upon how you use the authors will then depend if that comes before the sentence, as the sentence is being structured with the page number at the end, or if it's all together at the end. Please use your APA books or the APA online tools that you have available to you. The case scenario for you is about Alex. I have it over here on the right. It is also located inside the modules in module number 3 under the instructions, and you will also find it in module number 4 in the actual submission area. Please make sure that you're reading over this very carefully. Sometimes it's really helpful if you look at this as if this patient was talking to you, and take a separate piece of paper and start bulleting out the main elements that are coming forward to you in relationship to risk, social determinants, family health structures, and writing them out and putting them in those headings might help you to be able to address your areas more easily. If you have any questions at all, please don't hesitate. Make sure you're emailing me. I will be checking the question area frequently during this week as you guys begin to review these instructions, looking to assist you if needed and clarify. I hope you guys have a great week. I'm leaving you with a wonderful quote this week. Dear body, I'm sorry I've treated you this way, feeding you the wrong foods and not taking care of you. I promise to do better and get you back to the best shape and fitness level you can be. We can do it. Sincerely, me.